Well, we have different people with different orientations and things like that. So, what are the most common misconceptions about physiotherapy for knee osteoarthritis that you've come across in your line of practice?
Okay, in my line of practice, the thing about knee osteoarthritis, a lot of people believe that if you're having knee osteoarthritis, the next thing is for you to go and do surgery. You know, yeah. So the next thing, the only thing that can take it out is surgery. Now, but the thing is, not all OA is suitable for surgery. Now, the essence of the surgery, because they are going to take parts, they are going to take all of the cartilage and put some plastic work in it and the rest. So it's just to take away pain. And most sometimes you come out of the surgery, you're having so reduced movement even in the knee, you can't even climb stairs. Now, these are some people will have 90 degree of knee flexion max. Some people will even have 80 degrees of knee flexion. You know, these are the outcome, and that's why they will have to take them back to go and do probably knee flexion under anesthesia just to make sure they have good range of motion. But if you have 90 degrees in musical knee OA, yes, you're doing good job. So now, not all knee OA would actually lead to surgery. So a lot of people believe if you're having any arthritis, it's surgery. So that this is what I'm just going to tell is that you if it is moderate, you can even go about using your normal pain management. I forgot to mention pain management in my advice. So I would give them, okay, use a proper pain management. If it is medication that you can use to manage your pain, so you'll be able to do the exercise because both of them work hand in hand. Now, take pain medication to subside your pain and do the exercise. Both of them comes out great. Now, you might not even need surgery, with that. Then if you are to if you feel, oh, you if a patient should come to me now and say, okay, the patient have been seeing me for like 6 months now, and there's no, 6 months is even much, if 6 sessions, and there's not been any changes in condition, then what I do basically is to refer the patient to the specialist, is SMSK. So the reason why I said I'm not a specialist MSK, because we have people here that we call them SMSK, orthopedic choice. They are physiotherapy, but in an advanced. So I refer my patient to them to give this patient options. Okay, is this steroid injection? These people they are trained to give steroid injections. Then, or if they have tried steroid injections, because you can only have 3 steroid injections each year for for 12 calendar months. So you can only have 3, and you've had the first one, it's helped, then they can give you the second one. But if you have like 3 and none of it has helped, then they would likely send you to surgery. So that's a severe form of OA. So not all osteoarthritis, that's number one misconception. That's not all OA will lead to surgery. And another thing, like you said in one of the sessions, is that in our country, Nigeria, people believe that sometimes all of these things are they are is spiritual. Let me put it that way. So people believe that the thing about OA, especially in our kind of in Nigeria, is that I think we need more awareness on arthritis, basically, on the effect and the symptoms. These things. The thing is that you see some OA that would have been causing K-leg, that would cause you K-leg or deformed, the knee is getting deformed. So it is not the HIA that is making the knee, or they will say, it is my mother has the same issue. This was when she was 60 that she started having K-leg. Now, those kind is because of the arthritis has eaten deeply. And if, to me, I would say, okay, this kind of stuff needs surgical procedure for it to, for it to make sense, to align, the deformity, and also to help with the symptoms as well. So those are the 2 major misconceptions that I can actually think of now.
Thank you so much,
Yeah, that's all right.
There you have it, listeners. So if you ever feel knee pain, so sometimes knee pain is not exactly osteoarthritis. Not all knee pain are osteoarthritis, right? But all knee osteoarthritis are knee pain. if that makes sense. But whichever one, if you have knee pain, your best bet is to consult a specialist. I would refer you. I would want you to see a physiotherapist. Let them
Yeah.
assess you, then they can advise you further on the necessary steps to take. Thank you again, Ashade Gabriel, for coming on this show today. That will be all for on today's episode of Pulse of Wellness. Today we spoke about knee osteoarthritis. On the next sessions, we will probably be speaking about other type of osteoarthritis or type of pain. So please continue to follow us. Please connect with us, comment, share, and like. Subscribe to our YouTube channels too, so that we can be motivated to bring you more tips, more professionals to talk about the conditions you're having. Thank you. Bye for now.